Good afternoon, everyone, and sorry for the little delay today. The House of Assembly is in session, so we just left question period and we come down for our daily update. As you would see, the table is a little different today. As I said, we just left question period and the House of Assembly is sitting today. And Minister Haggie is in the House of Assembly today to deal with some important legislation through the Department of Health and Community Services. With that said, we do have our Chief Medical Officer with us again today, and I now turn it over to Dr. Fizgerald for our daily update.
Thank you, Premier. Good afternoon, everyone, and thank you for joining us today. Since the media availability yesterday, we have no new cases of COVID-19 in our province. The total number remains at 259. We have 241 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases in our province are female and 47% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and 2 are in intensive care. 241 people have now recovered, and in total we have tested 9,139 people. While another day with no new cases is definitely a promising step in the right direction, we will be closely monitoring this week and the next for any potential fallout as people begin to double their bubbles. I cannot stress to you enough that strictly following the orders at every alert level moving forward will be critical to our success, and I thank you in advance for your patience, understanding, and cooperation. As we navigate the next few weeks and months, we must remain steadfast in our efforts to protect our families and our vulnerable populations. The risk of COVID-19 is still very real in our communities, and we need to be extra vigilant to help mitigate this threat. The public health measures we have so diligently practiced are now embedded in our daily routines and must continue for the duration of this pandemic. This includes keeping a safe physical distance from others in public spaces, washing your hands often and well, covering coughs and sneezes, and staying at home as much as possible, and especially when you're feeling unwell. These measures will remain our best defense and will help prevent future outbreaks of COVID-19. I would like to acknowledge today the stress and worry prevalent right now among our business community. Business owners and leaders have expressed concern for their staff, the economic impact of COVID-19 on our province, and about what will be required of them as we move forward to Alert Level 4 in the coming days. We know your main priority right now is to reopen safely for the staff and public, and we will work with you to support you in doing so. I am mindful that every measure we introduce will have consequences beyond the control of COVID-19. This pandemic has been about balancing the benefits of these measures with the risks. I was happy to meet with the business community this morning to help inform the path ahead and look forward to working with them in the future. We have laid a solid foundation for moving ahead with COVID-19, and as we navigate the next level, I hope you will find peace and comfort in knowing how far we have already come thanks to our collective efforts, support, and determination. The path ahead may not always be easy, but together we will see this through. Tough times never last, but strong and resilient people do. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fizgerald, for today's update. I guess now sitting at day number 4 of reporting what is no new cases of COVID-19 in Newfoundland and Labrador. I will say that we've seen in the news lately, and disappointed to hear that over the weekend approximately some 90 staff members of Eastern Health came into contact with a patient who had previously tested positive for COVID-19. So as Dr. Fizgerald has said, you know, the staff members are following, like everyone else, are following the health guidelines at this very moment, and they are self-isolating for the next 14 days, and their symptoms are being monitored. They have been all tested, and none of them has come back to be positive, so that is good news. So the steps that these 90 people are currently taking is important, is precautionary measure on behalf of Eastern Health. So our message to these essential workers who are self-isolating at this time is we want to thank them for what they've done and what they will continue to do. It's those essential workers that we cannot say thank you enough. You have been the front lines and supporting the people of this province for many years, and you're doing so in what is one of the most darkest moments in terms of healthcare. And certainly in this pandemic time, it's the unknown that can create and add to that stress. Now it's time for you to take care of yourself and do what is necessary to protect yourself, your coworkers, and your family. So we indeed are thinking about you. We do know that the additional stress that this has caused can be challenging, both in your careers, your family, who are, I'm sure, thinking about you as we are. Please know that we will continue to be with you, to support you. You have supported us as a population for many years, and we will now support you at this time. We spent yesterday a fair amount of time talking about mental health, as this is Mental Health Week, and the supports that we have put in place for those people that need it. I want to once again thank Paula Corcoran and the executive director, who was the executive director of Channel, for joining us yesterday and sharing her insight on mental health and wellness. Now, Paula also spoke about the number of supports that are available that for those of you that might require it from time to time. And I think we all must remember that we're in this together. We are not alone, as Paula said yesterday. The website Bridge the Gap is one that we speak about quite often, and that's Bridge the Gap with GAPP in Gap, which says there's a list of supports and resources that are available for both the young and the adults. So reach out. You'll find a lot of information there that could support you if indeed you feel to the point where you need to reach out. One of the other supports that we haven't talked much about, although that's available, is called Doorways. And we haven't, as I said, had much discussion about the effectiveness of Doorways, but Doorways provides rapid access to mental health and addictions counseling. What's great about it is that you do not need an appointment or a referral. This is one of the big changes that we were able to make on mental health and as we provide services to Newfoundlanders and Labradorians. So if you're looking for that type of support, they are now offering counseling sessions. You can do this by phone, you can do it by video, and some other locations where it's appropriate, it can be done in person. What Doorways does is it offers a one session at a time approach. It serves children, youth, and adults. Now, if more than one session is needed, individuals can return to Doorways and be connected with other services and supports where appropriate that are in our communities. So this has been a great tool. This has been great support for residents throughout Newfoundland and Labrador, as Doorways now is available in over 60 locations province-wide. And I can remember speaking and rolling this program, and it's been quite effective in getting people to the counseling that they need. Now, if you want to find the location of where that service is delivered closest to you, you visit the website bridgethegap.ca. Or one other thing that you can do is that you can call 811, and they will provide you with the proper contact information and numbers and so on that is close to you. We would also, I just want to address for a few minutes the bed capacity for residents of Labrador. And it's something that I've had discussions with and is important information for the people that reside there. There's a group of, and what I'm talking about here would be around mental health capacity. And just an update, we put in place a group of professionals who are currently working on a new 6-bed mental health unit in Happy Valley Goose Bay. And this is something that I know Labrador Health Grenfell and others across the province has been looking for quite some time. So Labrador Grenfell Health has formed a mental health unit, an advisory committee. And on that committee, you will see individuals across the region. Some of them have had lived experience. Some of them are Indigenous partners. And this group is put in place to inform the development and the design of this new 6-bed unit. So we are pleased to hear that the project is now entering into the final planning stage, and building will begin and construction of this 6-bed unit in the coming months. This is a project that will provide even further mental health supports to the residents of Labrador. If I could switch gears for a moment to talk about the areas that are being discussed in the House of Assembly today. It's a different setting up there. We have about 10 members that are currently in the House of Assembly, and they're bringing in and dealing with some very important legislation. And as I mentioned in my opening, this is the reason why Minister Haggie is not with us today. He is in the House of Assembly. So we put a number of supports in place during the pandemic to help you and your family and your businesses and various industries in Newfoundland and Labrador. And some of this work requires some bringing back the House of Assembly from time to time. These supports are in every community, and therefore in particular to protect some of the most vulnerable. And today there's a number of legislative pieces that will deal with these very issues. Today we could deal with anything from supporting local businesses through this pandemic with a number of initiatives that will help set the stage for economic recovery. Also, from time to time, we need to take measures that if there's resources needed within the healthcare sector, that they are in a position to be able to respond. Today, there will be in the House of Assembly, there will be a piece of legislation introducing an amendment for pharmacists. And it will allow the Newfoundland and Labrador Pharmacy Board, and this is a group that actually license pharmacists in Newfoundland and Labrador if they see fit or have a requirement to issue an emergency registrations to pharmacists or pharmacy technicians. So if there is an area of immediate need for the service due to an actual potential threat to public safety, health and welfare, or if the federal minister makes that request. So this is really in the planning stages and just in case we need to respond to an outbreak with this virus in Newfoundland and Labrador. Also today, they're dealing with a piece of legislation around health guidelines and physical distancing. And what we're looking at in the House today is making amendments to the Wills Act, Notaries Public Act, the Commissioner of Oaths Act, and the Registration of Deeds Act. So what this will do today is it will allow lawyers, those that are in good standing with the Law Society of Newfoundland and Labrador, to witness documents which will include audio-visual technology. So this means that those documents can be witnessed remotely, given the fact that it's often now difficult to practice physical distancing in those types of practices. Also today, we're looking at making changes to the Public Health Protection and Promotion Act Amendment. And this will follow up, this will allow for such things as the Minister of Justice, upon request in consultation with the Minister Haggie and Dr. Fizgerald. So what it does, it allows peace officers to detain individuals and to convey individuals to a point of entry in the province and allow inspectors to even stop motor vehicles. So these are really just tightening up our borders as we relax measures, as people move, as Newfoundlanders and Labradorians move around. And the idea here is to make sure that those are coming in would be for essential workers. All of this work is to support you and your family during this health pandemic. It's about putting the necessary supports in place and proper planning and maintaining what we already have, what we've already learned in our lives to adjust what is now a new normal. So we'll continue to work together as we support each other, and this is where we will see change. We've been having quite a bit of momentum in recent weeks, but we do not want to lose that momentum by relaxing measures and introducing the virus into our community, if indeed we can put measures in place to curtail that. So we all know that it doesn't work unless we are working together. The time is now. We are still in Alert 5, moving to Alert 4 on Monday of next week. So we thank you for all the for how you have adapted your life in what is becoming a new normal for Newfoundlanders and Labradorians. But it's important now that we continue to support each other as we want to stop the spread of COVID-19. So with that said, I will now turn it over to the media for questions for today.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. I will ask each reporter by name to ask questions. Please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
We've heard concerns from unions that they weren't told when those around 90 healthcare workers needed to be isolated. Why wasn't that communicated to them?
Well, this decision was made with the Eastern Health. I was asked today in the House of Assembly when we became aware of it. I know at the morning briefing yesterday, I did not know that, and at the update that we gave at 2 o'clock yesterday was not something that we were aware of at the time. So unions work closely with the Eastern Health Authority, and at the point when we became aware of this, of course, we were. I know there were calls made to Eastern Health then. So it's important, I think, that, the individuals, you take the appropriate reaction or, response to this. I believe they've been able to do that with self-isolation that have been put in place. And these workers are now self-isolating, not even in their own homes. I think they're at outside in hotels or motels somewhere. So it's important. We recognize the impact this is having on families. But we also know that, the tests are being put in place. All those have been tested. And so far, those tests are coming back normal, what's been back. And, hopefully that trend will continue.
Dr. Fizgerald, this person had 2 negative tests. So by that standard, they were considered recovered. But then they had a further positive test. What should we read into that? Is this a problem with testing, or is this a problem with the procedures we have in place?
So the definition of recovery is someone with whose symptoms have resolved and have 2 negative tests. So I can't comment as to the actual situation of that individual patient. So that's the definition of recovery. The test itself is quite sensitive. So if there are any particles, and it detects the RNA that's in the virus, that's the genetic material that's in the virus. If there is any of that RNA present, then it's at a level that's high enough to be detected, even if it's just very faintly, it will be detected by that test. So you can actually have particles of RNA that are not a part of a live virus be detected, and that is unfortunately something we see with these types of what we call nucleic acid tests. So that is possibly one explanation in this situation, but the details of it, again, as I say, I can't speak to the details of an individual patient, but that's certainly something we see with these types of tests. So it doesn't mean that the test is inaccurate. It is just something that we see from time to time with these types of tests.
And on a different subject matter, we've heard from family members who are worried that for long-term care homes, if there are people who test positive, that Pleasant View Towers is going to be one of the areas where they're all brought together for other residents in the facility. Does that put them at increased risk of being able to contract the virus, especially with the way we've seen it go through other facilities elsewhere in Canada?
So I think we have to remember that if we are if anyone is significantly ill, of course, there will be and need to have hospital care. That will happen. It's difficult to isolate people in some facilities, and so if we need to isolate them, a place like Pleasant View Towers, which has single rooms, is certainly a more appropriate place to be isolated. These units in Pleasant View Towers are quite separated from each other, and they are locked units. The staff will not be moving from unit to unit. If someone is working on that unit, they will stay there. And, so all of these things have been thought through, certainly to reduce the risk in every way possible.
Our next questions are from Allison King of VOCM News. Please go ahead.
Wondering if the contact tracing is complete for those health science workers who were exposed to COVID-19.
So there would be no contact tracing for people unless they tested positive. So they are being quarantined, but the contact tracing would only happen if they tested positive.
Okay, thank you. I'm also wondering about locals who might consider leaving the province for vacations this summer. I know that tourists can't enter the province, but are there any repercussions for those who leave the province other than a mandatory self-isolation?
So if somebody were to, certainly we would encourage only essential travel. So we would be asking people not to travel outside of the province unless it was absolutely necessary. And if those people were to return to the province, there would be a mandatory 14-day self-isolation period upon return.
Right, thank you. And when it comes to essential workers who are working on rotation in other parts of Canada and they're coming back into the province and self-isolating, those people are just wondering what is being discussed and how long they might have to continue doing this self-isolation during their times off.
So I think that's a good question, and we can only answer that as you know, the epidemiology of elsewhere changes, and so we have to be looking at what's happening in the rest of Canada. But certainly we have seen significant outbreaks in areas where people have been returning, such as Curl Lake. So I think that in and of itself is evidence that, you know, we do need to be cautious in these situations. So it will continue for now.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead. Operator, do we have Kellyanne Roberts registered for the call?
She is in the call, however, she didn't press star 1.
Okay, Kellyanne, we're going to come back to you. We're going to go to Peter Jackson of the Telegram. Please press star 1.
Hi.
Hi, Peter.
I'm curious to know, related to the legislation about stopping individuals and vehicles, there's been a little bit of talk about how these health orders tend to suspend individual rights like peaceful assembly, freedom of movement. Are you worried about possible legal challenges that might come in as a result of these orders?
Yeah, thank you, Peter. We recognize the importance of, you know, the Charter on Canadians and indeed Newfoundlanders and Labradorians, but we are in a public health state of emergency at this point, of recognizing that there are steps that you could take to protect, you know, public health and take strong public health measures in Newfoundland and Labrador. So recognizing all of that, I mean, and, you know, when you detain someone, this is not about, you know, jail, or this is not about putting someone into a correctional center. As a matter of fact, some of the worst cases that we've seen within the country are coming from correctional services. So this is about, you know, anybody that was coming into our province without the proper plans, the isolation plans, and you know, the essential workers that will come back, that would come into Newfoundland and Labrador. It's just making sure that they're aware of the situation that where they are, and the rules that would apply. So if you cannot demonstrate coming into our province that you're here as an essential worker and have a 14-day isolation plan in place, you know, these measures are put in place today to make sure that our peace officers, our RCMP and our RNC, can take the proper enforcement measures that would be required. So, you know, this detaining someone is not about putting someone, you know, in a jail. I can tell you, for the most part, they would be put and taken and put possibly somewhere, if it was required to be overnight, into a hotel somewhere. You know, they would be treated very fairly. You know, meals provided and services provided, of course. But this is really about making sure we have the necessary tools to enforce the special orders that have been put in place by the Chief Medical Officer.
Okay, thank you. And I also wanted to ask Dr. Fizgerald, in their dealings with long-term care operators, do officials encourage them to let families see their loved ones in person in some way, through a window, if not a computer screen, particularly on special occasions? Because I think some homes are starting to sort of cut back on some of those privileges.
Well, certainly we encourage connection, social connection, and that's very important in people who live in long-term care and personal care homes. So we do encourage still that that the operators of these homes would participate in some social connection with family members for their residents. Absolutely.
So Peter, this is an issue where, as the chief medical officer said, social connection. And if residents that are in personal care homes or long-term care sites, it's important to have some kind of connection. It's unfortunate that given the measures that were put in place by our chief medical officer, that it visitation became a bit of a problem as we introduced the potential of introducing the virus to those long-term care homes or personal care homes. And we need to look no further than jurisdictions and provinces like Nova Scotia and Quebec and others, and realize that these are some of the most vulnerable that we have. And when it gets inside of those buildings and those institutions, that it's very difficult to control. And so it's really about making sure that we stay socially connected. We know that this impacts mental health. We also know that mental health, for a lot of our seniors and most vulnerable, also impacts their physical health. So it's important we do whatever we can to stay socially connected, even a phone call, as I said so many times. It's unfortunate those measures had to be taken, but it was about the safety of those residents.
Okay, thank you.
Peter, did you have a follow-up question? We'll go back to Kellyanne Roberts of NTV News. Please press star 1.
And those employees there that are now having to self-isolate. You say you weren't informed till after yesterday's briefing. Why was there such a lag in you and the government being informed?
So missed the first part of your question, but is it about Eastern Health, Kellyanne?
Yes, sorry. I'm wondering why there was such a lag in you being informed about the situation when some of those workers found out on Sunday.
Yeah, so that's a good question. The first and foremost, the most important part of the question is that the proper procedures and plans were put in place. And I found out about this yesterday afternoon. I did speak to the minister about this issue as well. So, what was important here, the most thing was important for me at least, was not when we knew about it, but the fact that the appropriate plans were put in place. And of course, we know that this is Eastern Health. From what the feedback that we've been given and the response has been that the appropriate measures were put in place, as they are the authority to deal with their staff at this particular point in time. And as I said in my opening comments, we're thinking about those over 90 people that have been impacted here, but the tests are coming back negative. And as a chief medical officer just described about the testing, we've all been learning some lessons, and we've heard Minister Haggie say many times now that it's possible for actually a dead virus to actually give a positive test. So that's what he's been saying for a little while. And so we don't know this is what happened in this particular case, but I think we're all learning lessons as we go along in this process about testing, about how the virus spreads within our community, either symptomatic, asymptomatic, and so on. So it is an evolving situation, but we're very pleased to be able to say that so far the tests are coming back negative for those that were impacted.
Thank you. And Dr. Fizgerald, I'm wondering if you can speak, knowing that I'm going to call them dead cells at this point, are essentially testing negative. Obviously, this is changing our procedures and the way we approach this. How are we rewriting policy to adapt to this?
So getting a positive test will, we have to react to a positive test as we would any positive test, which is what happened in this situation. And this has been a possibility with this test, with any of these types of tests. We use this type of testing for many other viruses. We use it for influenza and numerous other viruses. So we know that, no test is 100%, and we have to take this into account. And we do know that sometimes you can have pieces of the RNA in there that we detect. So our policies have been developed with that in mind.
Thank you. And I'm just looking at numbers. We're averaging over 170 tests almost daily. Obviously, we know the capacity of our centers are much higher than that. Is this just the amount of people that are coming forward with symptoms, or is there a lag somewhere else in the system?
No, that's anyone who's coming forward with symptoms is getting tested. as quickly as possible. That's just, the fact that everybody has been physically distancing and staying at home more has made a difference for all kinds of symptom spread or disease spread. And so we're seeing a reduction in not just, we're seeing a reduction now in COVID, but we're also seeing a reduction in other types of influenza-like illnesses as well. So, this social distancing and staying at home does wonders for reducing the spread of most respiratory viruses.
I think just a reminder, too, that these are people tested. These are not the number of tests. So the number of tests that would have been done by the lab would be significantly higher than this, given the fact that people are tested multiple times in some instances. So these would be about the number of people that are tested, not the number of tests that's been done. Also in areas where, if you look at Eastern Health, where some well over 90%, probably 94% now, we've had those positive tests, we've been able to actually do, if you compare it to the national standard, we'd be in the middle of the pack. So, there's been no restrictions on the testing. And the numbers, when you compare per 100,000, is simply as a result of where we needed to do the test, those tests have been done.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Can you go a bit more into detail about what is considered an extenuating circumstance when allowing non-residents to enter the province?
Sure. Thanks for that question. So we would consider medical reasons extenuating circumstances. So we've had some situations where people have had surgeries or medical procedures done and need to come back to Newfoundland to recuperate because they don't have anyone to care for them where they are, for example. There are people who have to care for loved ones who are having difficulties, for example, caring for a parent with dementia. There are people who've lost their job and had to relocate or are relocating for a job, who have retired and are moving back home. So people who are changing their address and moving back home certainly would be given an exemption. People finishing school and returning home from school, things like that. Those are the gist of most of them.
I think, once again, that the Chief Medical Officer has been a little modest in the work that's been done over the weekend and the last few days around exemption orders. They've been very busy, and I know I've gotten feedback from a number of people that were interested in applying for an exemption order, and they've been able to do that. I know that people are coming back, but they're coming back with their paperwork in place now, and hopefully those that are that can come back to Newfoundland and Labrador with the proper paperwork, the exemption orders in place, they're able to do that now, with the confidence that they're going to get back into Newfoundland and Labrador because they meet the exemption criteria. So I know they've been extremely busy in responding to those, and I know the turnaround for many of them has been within a day or two. So there's quite a bit of work going on in the early days, and this will probably subside a little bit in the future. But so far, I've been very impressed with the work of public health officials through this weekend and early into this week.
Great. And Premier, is there anyone within the government currently looking at long-term strategy when it comes to tourism and how we can quickly restore the tourism sector and, traveler confidence once the pandemic is over?
So when you look at the alert system that's been put in place, and we recognize that this summer will be very difficult. Some industries and businesses will be able to respond and adjust their businesses, but the tourism industry, it is very difficult to be able to do that, especially with the international and out-of-province travel being so restricted. And so we will, we've taken the advice of the Chief Medical Officer. We need look no further than south of the border when we see what happens when politicians get involved on public health orders. That is not something that we're prepared to do, but what we are prepared to do is work with the businesses that will be that will have difficulty. And so we're working with those groups. The tourism industry is a big focus for us because we want to make sure that coming out of the health pandemic, we have a good, strong business community that we're ready to rebuild this economy on. So yes, we'll be working closely with the tourism industry, like we will with other businesses as well, but realizing they're one group that will find it very difficult to respond quickly to this because of those restrictions.
And I was also wondering, do we currently know how many healthcare workers are self-isolating in total, and if any have tested positive?
So the number that I would have with healthcare workers self-isolating. So that
anyone in the healthcare industry, so from even including janitorial staff to doctors.
So 203 would be the latest update that I would have had, and that would have been as of today. So they would be the number of staff that would be self-isolating. And the number of them that would have tested positive would have been 16.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
The new measures for enforcement, Premier, you said people could be reconveyed to the border. There could be checks. People could be stopped. There could be vehicles stopped. I'm just curious, who are you targeting here? And specifically, I'm assuming this would be people who aren't from Newfoundland. Why take them to the border? And what's in place to ensure due process for this sort of thing?
Well, I think many people were concerned about what would happen if people would just showing up at our borders, and they would be coming into Newfoundland and Labrador, and with them they would be bringing COVID-19 with them. So this is really this is based on the principle as we start to relax measures within Newfoundland and Labrador. It was important, number one, that we have the proper PPE in place in case we needed to respond to an outbreak, making sure that the capacity was within the healthcare system that we could respond. And, obviously we talked about the idea of a surveillance app that would be available if on a volunteer basis, but also making sure that the borders were tightened to the point that people could just not wander into Newfoundland and Labrador without having a quarantine plan or self-isolation plan in place, but knowing too that they were coming here if only if they had the proper exemption orders in place. So this was really about protecting Newfoundlanders and Labradorians from people that were coming into our province, and they were non-essential, just essential travel only within our province. So this was an enforcement tool that we couldn't do, and working with the RCMP and the RNC, this was a tool that they needed to be able to put in place the proper enforcement mechanism.
How can the government justify having had a plan and a stockpile of equipment to use in the case of a pandemic, and then to have allowed that material to expire, to not replace that material for what you can only assume would be for financial reasons? How do you justify that taking place?
Well, it's a good question, and it's one that we've been. I know Minister Haggie just answered that in the House of Assembly, that realizing that this stockpile had expired prior, and this decision was made prior to 2015. It's important now. I think a lesson that we would learn from all of this, and this is part of the discussions that we're having now currently as premiers with the federal government and with all other provinces, that we must make sure that one of the early lessons that we learn coming out of this pandemic is, number one, that we have a procurement supply, that we can actually make this protective equipment in Canada and make sure that we have good production facilities. This could come down to ventilators, which we now know can be manufactured in places like Ontario, making sure N95s and material that will go into those masks, the protective equipment that would be required. So I think as we come through this and people sit back and debrief and look at what lessons we would learn, one of the things that will be a priority on that discussion was a secure personal protection equipment, and not only just to have the supply necessary, but make sure that we have the manufacturing capacity within the country to do so.
But do you personally have a regret that we did have a supply, and then in the years that followed, many of which you were premier for, that this supply didn't exist anymore?
Well, I think from the expiry point of view, I think what needed to happen in that particular case, I mean, is when you think about this from a business point of view, just not just from a social or public health point of view, is what you would do is you would take from that stock as before it expired, you would use it, and then you would replace that stock with something that had a longer expiry date. So there's no question this is the stuff that should have been occurring at the time coming out of the decision that was made to purchase this inventory for public health. So that inventory rotation didn't occur. It was allowed to expire therefore, obviously inappropriate to be used for the most part. So that was a decision that was made at the time. It's important now that the lesson we learned coming into this, that we make sure that we can maintain a good supply of PPE, because recognizing there's going to be a demand on PPE, just not for public health, but for many private sector groups as well. We're seeing PPE used in fish processing plants as an example this year, where last year would not have been. So PPE, I think, going forward will be important discussion that we will need to have both on manufacturing and an adequate supply. No question about that.
Our final questions today are from Kevin Bissett of the Canadian Press. And operator, this call is scheduled to end at 2:59 p.m. If the reporter's questions haven't been answered, I ask that you keep the line open, please. Please go ahead, Kevin. Press star 1.
Pretty quick questions. You mentioned about the staffing of the border points. I wonder if you could explain who is staffing the border points to stop and question people when they arrive. Is it just the RCMP and the GNC, or are you using other enforcement officers like Fish and Wildlife and Forestry, as some other provinces are doing?
Yeah, there's a combination, and sometimes it's determined about where the point of entry would be within. As an example, in St. John's Airport here, we would see the RNC, we would see public health officials. If you're in the Marine Atlantic, you would see officials from Fishery and Land Resources. If you're in Labrador West, you would see the RNC along with the Quebec Police that would be used there. And in the terminal in Walbush, you would see some public health officials as well. So it's a combination of people depending on where that point of entry would be. But the RNC and the RCMP are largely in part and responsible for the enforcement of those measures.
And so do all have the authority to turn people around, and how many have been turned back?
The RCMP peace officers would have the authority to turn people around, and that would be the RCMP and the RNC for sure. And I'm not too sure where the work of the Fisheries and Land Resources would be at this point, but the RCMP and the RNC for sure.
And how many have been turned back at this point?
So far, I wouldn't be aware of any that would have been turned back. The House of Assembly and the measures and the enforcement legislation that's required to support the RNC and the RCMP at this point is going through the House gun, I guess, as we speak.
All right, thank you.
Thank you very much. The time for questions has ended. We thank you very much for tuning in today. Please join us again tomorrow at our regular time of 2 p.m., 1:30 in most of Labrador. Have a great evening.